All right, good evening, everyone. So welcome for joining tonight. I wanted to give a warm welcome to all of our attendees. And my name is Dr. Keley John Booth. And in this webinar, I'm going to talk about a revolutionary orthopedic treatment approach called Regenexx. Many of you have probably heard of Regenexx. For those of you that haven't, you're going to learn more about that this evening. And I will discuss how this advanced treatment option could help you potentially avoid traditional invasive surgery. So if you're considering surgery, you should definitely stay tuned to see if Regenexx is right for you. If you think of any questions as we're going along this evening, please send them to our moderator during the presentation, and we will strive to answer all the questions that we have time for. So those will just end up in the queue, and we'll be able to get to those throughout the presentation. So let's go ahead and get started. All right. So basically, what we're going to start talking about this evening. Let's see here. I'm going to transition over. And so tonight we're focused on advanced surgical alternatives. So, and Regenexx, as we mentioned, is an alternative to invasive surgery. And you have essentially the most trusted alternative to orthopedic surgery. The network has been in existence for a number of years, and really is leading the way in regenerative treatments and providing options for patients. So I'm going to go ahead and enable my pointer. So in case I want to point a few things out as we're going along. A couple of things about me, just as a background. So I've graduated from the University of Oklahoma, Boomer Sooner, for those of you that are OU fans. And but we're also OSU friendly out here. So we have multiple people in our practice that also are good fans, and my brother graduated from OSU, so I guess we have to acknowledge our Cowboy fans out there. So 20 years of experience in spine and joint and ultrasound guidance specifically. It's literally been over 20 years since I was first trained to perform ultrasound guided procedures. I've also been performing for about the same amount of time X-ray guided treatments for both chronic and acute pain within the spine, and then extend that into peripheral joints as well. So I look forward to the opportunity to help you potentially avoid surgery and find you some options that give you better quality of life and get you back to the activities that you enjoy more regularly. So, so why you're here, those of you out there with joint pain, spine pain, injuries that you've accumulated over the years, or maybe you've experienced something relatively recent that has been plaguing you, and you're trying to look for options to find a way around, the potentially anxiety-provoking, open procedure, and you don't have time to take off maybe from work or family activities for longer-term recovery that's often required with surgery. So those are a lot of reasons that you may want to be here and learn about what the alternatives are. And so seeking advanced treatment options, many times when patients come to us and they say, oh, we're so glad we found you because we were told that we really didn't have another option besides surgery. And unfortunately, in the traditional orthopedic approach, as you'll see, as we discuss here tonight, you're going to understand that there's really one pathway, and it kind of all roads lead to surgery eventually. And so those are one of the challenges we have, because while they may be offering everything that they have, they certainly are not able to offer you the most advanced non-surgical treatments. So all right, so what are the obstacles that get in the way? Of course, money, time, confusion about what's out there, what works. You'll hear things, oh, this doesn't work, or that's better, or you should go here or go there. And we're going to try to certainly offer you some reasons why you should really consider Regenexx, the leader in this field. And our providers, including myself, all go through a rigorous training protocol to be able to become a Regenexx provider. And we're all essentially trained to recognize where we have an opportunity to use a non-surgical approach and use biologics to help you recover and improve your condition. And of course, there's always fear and anxiety. One of the big ones is, fear of pain after surgery. And that's a real concern. As a board certified anesthesiologist. I've dedicated my career to a field that helps people with not just musculoskeletal concerns, but obviously, controlling pain. And that's another thing that I get a lot of personal satisfaction of, helping people have a much less painful treatment opportunity. And of course, you want to develop trust with your providers. Many times we meet patients and, we'll tell you, look, if you're not a candidate, we don't think you have a good opportunity to heal from something that we're doing, then we're going to tell you about that. And we're going to say, we do think that maybe surgery is the best option, or maybe some other non-surgical treatment may be an option for you. So we pride ourselves on always treating patients truly as family members. And I tell patients, look, I'm telling you the advice, given what my extensive background experience have provided me the opportunity to learn and know. And I tell you what I would want to hear if I was in your position and you were standing where I am, explaining, what maybe you should contemplate. So developing that trust, I think, is important. And so we always try to work with patients to educate them and get them the information they need to make the best decision possible. All right. So the history of Regenexx, Regenexx was first in the United States. Dr. Christopher Centeno was the first physician in North America to perform a stem cell injection into the spine. And that's pretty exciting. And that is something that really sets this group apart, this affiliate network of physicians. It's now international. And so we have a lot of experience in these areas, and a tremendous amount of research has gone into this. Over 150,000 procedures have been performed to date by the Regenexx network. So we just have the depth and breadth of knowledge and experience there. So that's where we get in. We just talked about, the most procedures really performed in terms of tracking the data behind the procedures. We have one of the largest databases of patient treatments in the field in the world. And we have access to that data to try to help improve outcomes and help patients really reap the benefits of what we do. Beyond that, safety profile is really outstanding. In many ways, it's difficult for us to even calculate the safety because it's so much safer than surgery. The complications are so infrequent that it's almost difficult to measure that and quote a number because our patients do so well. And so in our clinic here, we've had exactly zero rate of infection, which is outstanding. And that actually is for all our procedures, not just Regenexx, but everything we've done. So private practice for going on 17 years. And so we're very conscious of the need for techniques that decrease the risk for patients. And that's really paramount to us. And I always tell patients, look, your safety comes first, and your pain, discomfort, and your disease condition is a close second to that, but we never compromise on safety. And also we have among the most researched procedures being performed in the regenerative world. A lot of work has gone into that. And I benefit from the researchers and the providers in the network that have done a tremendous amount of work over a number of years. We're about to celebrate 18 years as a physician affiliate network. And so tremendous amount of work, thousands of patients reviewed, studied, and published articles in peer-reviewed journals. And so that is also another really unique aspect of Regenexx, which contributes to us being a leader in the field. All right. So, and so Regenexx, we kind of hit on a number of those topics. We have a couple key points that patients may want to understand. Treating multiple sites. I saw a patient just this week where we discussed a wrist treatment that we would be able to do in conjunction with a knee treatment. And they actually had the problem, carpal tunnel syndrome in both wrists. And we were able to also work in the ability to treat their knee at the same time. And in any other setting in traditional orthopedics, that patient would have had to have as many as at least three procedures on 3 different occasions and 3 different recovery periods. And obviously the downtime associated with that, not to mention the cost, those are all concerns. when we're doing that, but we are going to be able to treat that patient with both wrists as well as their knee all simultaneously. And we do those types of multi-site treatments pretty routinely. And that's one of the major benefits that really helps get a tremendous value out of what we do. So one of the other interesting things too about Regenexx is that we have over 600 employers nationwide that offer Regenexx as a benefit for their employees. And that is completely unique. We're unaware of any other network for regenerative that has anything like that whatsoever. Really the absolute leader in that area. So these are companies that are that have plans that are managed by Blue Cross, United, Aetna, Cigna, other major insurance companies, and we're providing Regenexx to their employees. So, hey, we have a flexible lab platform that enables us to essentially create and develop from your own tissue a wide range of orthobiologics, and you'll learn more about what that means and later, and hopefully I'll have a few questions about that. We can talk about, you know, the difference between PRP, bone marrow, and those things. So, and of course, we really want to always use your own tissue. That's all we do, because we don't want a foreign source tissue such as an amnion or amniotic product. For those of you that have seen those in use, we don't recommend that because there have been a lot of challenges with the groups that have essentially produced those, and there's been the FDA looking into a number of those sites, and they've been cited for you know, having some practices that can cause some potential safety concerns. Okay, so all right, so moving on. So our goals tonight is to help you identify some alternatives to traditional orthopedic surgery, help you discover if you may be a candidate. And of course, that always comes down to scheduling a new patient evaluation, where I will personally come in the room, evaluate you, perform history, physical exam, and I will personally go over your imaging studies, order new ones that you may or may not you know, have had before, because time frame is important. So we always get everything up to date and make sure that we're giving you the clearest picture of what your diagnosis is and what your opportunity for treatment is. So, and also we're here to help you schedule. You can reach out to our office, and Amanda Thomas is our Regenexx coordinator that enables everyone to kind of get through and get onto the schedule. And we have an entire team of people behind her and I that actually facilitate getting you in. So we want to make this as a pain-free process as possible. And for those of you that join us from out of town, out of state, we deal with that routinely. So we do have patients that travel quite a distance for care here because of the unique nature of what it is we do and our unique experience in these areas. All right, so I wanted to start off by telling a story here, also from a clinical perspective. And I had a medical account executive that I had the good fortune to meet, and she was suffering from osteoarthritis at an early age. And so many times there's some genetic predisposing factors that patients suffer from that you just, you know, it's one of those things that comes up. And she was in her early to mid 40s and began to suffer arthritis at that relatively young age. And as a busy mother, she just didn't have time for that. She was really, you know, keeping up with her career and with her role as a parent, dealing with all the things that come with that busy lifestyle, and also has a successful career as an account executive working with medical practices. So ultimately, she did undergo a knee replacement, and really had some unexpected challenges after surgery when she was really expected to have, you know, a great recovery, and was kind of felt like she was led to believe that this would just be kind of easy for her given her age, again, in the early mid 40s. So, but following surgery, really almost immediately, she began to suffer from pain, swelling, stiffness in the site of surgery site, and just never really quite rebounded, and couldn't quite figure out what was going on there, because she felt like that she was really supposed to heal and get better much faster. So ultimately, she knew she had arthritis in both knees, but the opposite knee was starting to then cause problems for one reason, because she was having to use it more and more because her replaced knee was no longer really functioning, not even as well as her the knee but prior to surgery. So ultimately, she said, wow, I'm really concerned. I don't think I can go through a second knee replacement on the opposite knee. And that's when we had an opportunity to talk, and she said, hey, I want to see about having a Regenexx procedure for my knee and try that instead of surgery. So ultimately, she also, I wanted to mention, she had some ankle pain on that side as well. And that was something that really they hadn't been able to contemplate. And driving around, she would drive to different cities to support her clients and her different accounts. And so ultimately just driving, and I remember that description, she would talk about pushing the gas pedal and how by the end of the day, that would just aggravate her pain to a significant level. And that was something that really, when they were working on her knee, they didn't feel like they had an opportunity, to do much with that. So she was also having arthritis in the other knee, as we mentioned. And really, she said, I can't be down for, another, 3, 4, 6 months, and really was still in the process of recovering from the other knee surgery. So ultimately with that, there's challenges. She said, hey, I really want to try, to see what else we can do here. So ultimately it was determined that she was a good candidate for the Regenexx SD procedure, which involves a bone marrow treatment using live cells from the pelvic region. We actually take those in the posterior pelvis there, and we performed a multi-site treatment ultimately with including her ankle, which was kind of a bonus for her because that wasn't something that she was originally going to be able to do had she gone with a surgical solution. And ultimately she did have fantastic results, and she was so pleased that she said, wow, in retrospect, she wished that she had tried that for the original knee. And unfortunately, as of this time, she's actually scheduled for a revision surgery on that original knee. And so that knee only lasted about 2 years, if you can believe that. So she's going to have to go through another surgery and have another surgical recovery. So that's tough to deal with. But I just kind of tell that as a cautionary tale, because it's difficult to go back, after you've had a knee replacement, you basically don't have the opportunity because the anatomy is fundamentally different. Your knee is essentially, the joint has been taken out. And so there's really not much that we can do after that happens. So, and here is her, in her own words, she wrote us a review following that. And I really appreciated her kind words. And, she talks about that, she really appreciated everything we did. So that's just, kind of one story that I think really hits home with a lot of people when you think about, wow, to have to deal with that kind of diagnosis in your 40s and what your options may be. So, but just a good story. So here I want to take some time. Maybe that triggered some questions. People may want to ask a few things in regards to, about their own situation. And I really want to personalize this for you to get you some information that may be useful in making a decision about how or why you may want to pursue Regenexx. So I'm going to look over here and pull up my questions here. Let's see. All right. So in my Q&A, all right, we've got our first question is, how do you know where to place the cells? So, and that's a great question. Ultimately, we're going to basically do a complete exam for you and basically look at that from the standpoint of what is your diagnosis? And this is where you see a real large chasm between traditional approaches and what we do at Regenexx. And so the idea is basically that, let's see here. I apologize. I got off cue there. So, basically what we're doing is working to find the source of the problem. So if you come in and you actually look at what the surgeons do typically, many times, the overwhelming majority of the time, they look at an X-ray and just say, hey, there looks like there's not much space between the bones. There's, some bone damage. Okay, really, we don't have anything else. We're going to go ahead and send you to surgery. And so the idea there is, for us, is we're actually coming in and saying, no, we like to see MRIs. We do diagnostic ultrasounds, and we actually come in and look at that joint tissue and see how much of that is there. This is a time where the word bone on bone, or the phrase bone on bone, gets really overutilized, and people are told that, and they just assume that that means they have no cartilage left. So I can tell you that I have never examined a knee that didn't have any cartilage left. They all have cartilage in there, and I've never seen one either cut out in surgery, because I've personally been in hundreds of knee surgeries. There's always cartilage. It's just a question of the quality and how degraded it is. So when you say bone on bone and you look that up in a medical dictionary, it doesn't exist in a medical dictionary, because it doesn't really have a clinical meaning. It's not a diagnosis. There's no code for bone on bone. So it's just a common phrase that gets used. And so that's a key distinction that I wanted to make there for you. But ultimately, what we do is we find out where that damage is, and then we really focus in on it. And then we apply the cells directly using a guided technique with a specialized X-ray machine or an ultrasound machine to actually go in and deliver those right at the source. And so that's essentially, how we decide how to do that. So, all right. So, and beyond that, let's see, a couple of other questions. So can you treat more than one area at a time? And I think we did answer that during the case presentation, and absolutely. And matter of fact, we prefer to do that because it provides such a value to the patients for us to just come in and say, hey, let's do that for you, because we already have the equipment open, the kit's open, and we can go ahead and process a little more blood for you and do that. So no problem treating more than one area. And then how fast can you expect to feel better? That completely varies on the level of disease. And it also essentially is dependent on those factors. Most importantly is higher severity becomes a bigger issue, to see what that looks like. But the nice thing is that with these treatments, we typically see patients benefit for months, depending on, again, the pathology, whether it's a knee or back. But very often we see patients benefit, and our data shows patients continue to improve even for years. And so, all right. So then here I see it. There's a question that asked, if you've had a neck fusion, is Regenexx still an option? And I would say yes, and that with a few caveats. So I personally have performed treatments on patients with a previous neck fusion, and the reason is because you're not fused at all your levels, or you're hopefully not. If you're fused at all the levels, then that becomes an issue. It becomes harder to provide really some meaningful benefit. So typically regenerative procedures work better on joints that still maintain their natural physiology. And above and below your fusion, you still have normal tissue. So that is still an option, even if you've had a fusion. All right. And then let's see here. And I have a few other questions, and we have another question session that we're going to get to here in a little bit. So I'll hopefully get to your questions. These are great questions, by the way, and it really helps others, to get those out there. So keep them coming, and we'll work our way through them. All right. So here, I'm going to bounce back into the presentation, and I want to talk about traditional orthopedics. Traditional orthopedics suffers from, historically, it's a one-track mind, and if you go and you train to become a surgeon, you kind of see the world through surgeons' eyes. And their idea, right, of a exciting day is very different than that, of what the patient may really hope to have done, because they didn't go to all that training and spend all those times in surgery so that they could provide you with a non-surgical alternative. That is not their goal. That's not their focus, and they'll be the ones to tell you that first. And so I always explain to people, if you want surgery, start with a surgeon. If you want a non-surgical treatment, then go to an interventional specialist that specializes in non-surgery. So just like they've spent their careers and practices trying to perfect the surgical options, I've spent my career perfecting the non-surgical options. And I can promise you, you don't want me to perform a knee replacement for you, but just the same, I can promise you that there's a lot of surgeons that you probably wouldn't want to do a interventional, precision, treatment, regenerative treatment for you, because it's just not their forte. Very different tools, very different training, very different thought process. And literally from the moment we begin to evaluate patients all the way through into recovery and how we manage that are very different. So, all right. So here's kind of a picture, not a super flattering picture, but it's just the reality of surgery and what that world is like. We deal with a lot of equipment, a lot of replacement. You can see there where you can have multiple joints replaced. Rarely ever do they do multiple joints at once. That's a major advantage for us. But yeah, there are people that actually get that done. So, and the challenge is that, it's more or less kind of a one-way street. It's kind of expected that a patient that has even moderate levels of osteoarthritis, that it's, orthopedics just, the attitude is, hey, it's going to get worse. And ultimately, you're going to come back and see me. And when it's bad enough, you're going to come in and you're going to ask me, to do a joint replacement, ask the surgeon, not me, but ultimately that's kind of the way it's going. It's a one-way street. And that's been traditionally the pathway, for decades now. And we're doing more and more of that. We just read a recent report that as of the year 2030, it's estimated that as many as 3.5 million knee replacements will be performed in the United States every year. That is astonishing when you look at the numbers. All right, so and what are the challenges, right? Blind steroid injections, using steroids in the knees, after as little as 2 years, you can actually see a loss of cartilage. And here's the study that's referenced where they actually could see a decrease of the cartilage within 2 years, as little as 2 years. And that's doing it once every 3 months. Unfortunately, patients sometimes get it more often than that, and then ultimately lead to faster degradation. All right. So then, and beyond that, the next stage, if you will, is arthroscopic surgery. I had a patient literally today that I saw who was offered arthroscopic surgery for a degenerative meniscus tear, despite the fact that we have over 20 years of data showing that there is essentially no benefit to that surgery. It's matter of fact, it's been proven repeatedly that surgery is no better than doing what they call a sham surgery, which means that they make the incisions. The patient doesn't know whether they've had the surgery or not, but they don't do the surgery in part of the patients in the study, and then they do it in the others, and then they have a specialized group of physicians that don't know who really had it and who didn't. They evaluate them, and they could not tell the difference between the two groups of people. And again, that study's been looked at closely, and even repeated outcomes have been shown. And there's a call internationally among orthopedic surgery groups that it's not even recommended to perform that procedure anymore. But despite that, it's still covered under traditional healthcare insurance. But the same healthcare insurance may not cover a non-surgical regenerative technique that actually costs less in many cases, and far less risk. And so that's fascinating to know. But when you look at that, it really makes you scratch your head. All right. So then, and what do you get when you take a blind steroid injection repeatedly that ultimately will fail and potentially make the knee fail faster, and you mix that with a procedure like a meniscectomy through a knee scope, you ultimately get a knee replacement. And those are the traditional results of that pathway. That pathway has not changed literally for decades, and that is still today. And matter of fact, most of the focus within the field is to do more of the surgeries more efficiently, because they're trying to figure out how are we going to get to that point where we're doing 3.5 million of these surgeries every year. And what are the challenges there? Well, challenges are big. You've got about a 1 in 3 rate of dissatisfaction with the surgical alternatives, a 1 in 5 rate of chronic pain after surgery. I can tell you, unfortunately, regardless of how well it works, it can be mechanically perfect. You can still have pain in the knee that significantly alters your quality of life, and that's tough especially when you know it works well, but yet it just hurts. And the reason for that is it's a massive trauma to the tissue surrounding the knee. It just is. That's part of it. Beyond that, a 1 in 5 complication rate, including, of course, minor complications, but a 1 in 20 rate of serious complications, and a 1 in 100 rate of infection with those knee surgeries. And this number is really hard to swallow, but it's 1 in several hundred rate of mortality, meaning that the rate of death goes dramatically up in patients that have simply had the joint replacement. And this is, look at this as for relative to your, driving on the highway, going down the interstate. When you do that, you have about a 1 in 7,000 chance of dying in a fatal accident over the span of 1 year. That's the average risk to Americans currently, just by driving, on the interstate. And so you put that in perspective and you think, wow, that's a pretty significant, concerning potential level of risk. So something to think about. And I think a lot of people really don't quite understand that there is significant risk there. And part of this is that based on age, the trend is obviously towards higher age groups in terms of people that basically do get this procedure. And so it's more common for patients in their 60s and 70s to have this procedure overall. So that's part of it, because it's a higher risk population in terms of having a potentially significant side effect. So, all right. So what about spine surgery outcomes? We've got a couple of questions about spine earlier today, and I'll kind of jump into those. So as many as 2 in 5 patients have pain after their spine surgery. So that is a large number of people. So stated another way, as many as 40% will still have pain, in some cases have new pains that they didn't really recognize prior to surgery. So, and about 1 in 5 will require a secondary surgery due to complications at a later time. Many times, and I think that's a pretty conservative rate in my personal experience. I see patients, the majority of the patients that I see that have had spine surgery will have at least one, if not several, in their lifetime. And so that is one of the concerns, is because as you go in and do that surgery, you're going to destabilize other tissues around that area that you're working in. And that's just part of it. And ultimately, that puts a lot of stress on the joints and the discs above and below the level of surgery. So, all right. So, and, unfortunately, there's been some, deep analysis into this. And this is a study published by the Patient Safety and Surgery Journal in 2017. And, the question was, hey, why are we still performing these potentially unnecessary surgeries? And, especially when spinal fusions for back pain did not lead to improved long-term outcomes when compared to non-operative treatment modalities. Now, that's really pretty amazing, but yet patients very often will come in and say, well, I just want a permanent fix. Well, unfortunately, the biological systems don't work quite that way. And there's a potentially heavy price to pay, for having a major surgery. And that's why we always think it's a good idea for you to explore what your options may be. And again, not everybody's a candidate for what we do, but when they are candidates, and the majority of people that we meet actually are, very often we're able to help them and do something that's much less invasive, with a much shorter recovery time. And so this particular article will be talking about more down the road, because it was really got into the history of surgery and how it's not always been something that you could say 100% we did this because patients needed it. There are surgeries being done every day in the United States that aren't necessarily required, and I think that's putting it mildly. Okay. All right. One other thing I wanted to point out about spines and that we see very often, and it kind of gets into the difference between how we approach things. This is, as one of our cases, a really good example of the multifidi muscles, the primary muscular stabilizers of the lumbar spine. And here you can see these are actually in cross section. And this shows where that slice is through the low back. And so right here in the back, just above the buttocks, is where this slice is taken. And you can see that muscle. And if you see this nice coloration, you see how, just advance that on you, sorry. But you can see that shape. And I want you to compare this to this picture down here that's from a different patient that actually had surgery. Now, this patient, you can see here the little white marks. That is actually hardware from a spine fusion. What's fascinating about that, at that same rough level of cut through here, you can see the difference between this and right here. You see all the white. Well, that white used to look like this, but previously actually had muscle in there. And you can see how relatively flattened that is. And this is the peak of the bone right here. And then you can see that muscle coming around on both sides. And here you see the bone and you see that muscle coming out like that. So this is a very healthy specimen. I chose this one because that, you can really see, pre-surgical. What's fascinating is this patient also had back pain. And ultimately we were able to treat this patient and help them with their back pain. And they do have some disc disease. You can actually see that here. But they wanted to avoid these kinds of post-operative changes where you can literally see if this muscle gets to this stage, it really is not doing anything. It's not able to stabilize your spine. And it's no surprise at all to us that this lower level is now going to suffer and begin to have problems. So that's a really dramatic example that shows you why that's so important. And these are, again, things that we look at when we're evaluating you to try to figure out what your treatment options may be. So, all right. So in a nutshell, we want you to rethink surgery as your first option, right? And explore the world of alternative regenerative approaches. And we have a lot of data and a lot of opportunity to address those things. So, all right. So we're going to stop for a couple more questions here. And as we come in here, let's see, I'm going to pull this up and read those for you. All right. So it says here that this is actually referring to the case that I presented, the mother that had the SD bone marrow procedure. What's the difference between when we decide to use bone marrow, let's say, versus a PRP injection? So a PRP injection is essentially a blood-based treatment where we actually collect blood from the patient and we process that to concentrate the blood platelets. Inside the platelets, you actually have growth factors and proteins that are used in the natural healing process. And that happens if you were, let's say, to cut your skin. That is one of the first things that happens is the platelets flood into the area, stick together, and begin releasing these growth factors and proteins. And so we've been able to use that as medication and essentially concentrate those and place them in an area to generate a healing response and get those benefits that are really built within you, but that are hard to get to that area without having had trauma in that area. And so that's really the neat trick that we're able to do with our guided procedures. We can place those in very specific areas. And so that's platelets. And we use that, again, from blood. On the other side, bone marrow comes directly from inside the bone marrow and is entirely different tissue with live cells that we process and concentrate that can help you generate a healing response much more vigorously in the cases when you have a more advanced stage of arthritis. And that's something that's really been shown to provide more significant benefit than just a simple PRP injection. However, PRP can be very effective for people that have lower levels of damage to the tissue. And very often, actually, I wouldn't say very often, we always use PRP in conjunction with bone marrow. So by its very nature, a bone marrow treatment will result in us going ahead and using PRP, and those growth factors can help activate the cells, part of which are stem cells inside that bone marrow. We can actually activate those to provide a more localized healing response in the tissue that we're targeting. So, all right, so that's a great question. And then here, this is not a question, but a comment about, oh, wow. And this is actually one of our patients. So we have that's commenting on here, and he's commenting about how he's 6 weeks out from his procedure, and said, hey, he's doing great. So that's always good to hear. So I appreciate that comment, and thank you for that. And that's exciting. So that's kind of neat where we see our patients pop on and check in with us. So, all right. So the question on the last question I have on that section is this covered by insurance, and what are the costs and those things? So insurance, I think I mentioned in the beginning, you know, there's a potential there if your employer covers this as a plan. Now, if they do, you would have received a Regenexx card, and there would have been an introduction to the plan through your employer-based insurance plan. They essentially do that for everyone. But in case somehow maybe you missed it, you can always look into that. And of course, we are able to find out when you call us and you schedule your appointment if in fact you do have Regenexx as a benefit. I have seen multiple patients come into the office, and we weren't aware at the time until they told us, hey, I've got one of the insurance plans that covers it is Samaritan. And so we actually have patients that come in and they were expecting to pay out of pocket, and ultimately it was covered under their insurance. So it was great surprise for them, and they really pleased. And usually when it is covered, it's well covered. The out-of-pocket expenses are relatively limited to whatever the deductibles are in your plan. So that ends up working out quite well. So definitely there is opportunity, and those opportunities are growing every year for patients to have that covered under their employer-based insurance plan or Samaritan, as I mentioned. Otherwise, the costs vary dramatically. So a very basic procedure for us that is just a small, simple procedure may be something, on the order of $1,000 to do, a simple injection. And it can go up from there depending on the complexity, the number of sites. And when you start looking at bone marrow, that's a much more involved procedure. But we only recommend that if you have the level of degenerative disease that actually warrants that level of treatment. So we match your level of disease and what's going on to what we need to do. And so we really flex in there. And I have some patients come see us just because they say, hey, I know PRP can help me, and I have had some issues with knee pain or things in the past, and they get a proactive injection of PRP, and they just stay on top of it because they want their joints to function as well as they can and preserve them as long as possible. And so for patients like that, we're able to do, for example, maybe an annual PRP injection and stay on top of that and monitor the joint functioning for them. So that is something that we do as well. All right. So, and basically that, let's see here. All right, and I'm getting a shout out from Dr. Santana, my colleague here, and I'll send a shout out to him for those of you that are interested in alternative primary care medicine, including functional medicine. Dr. Santana has joined us in our clinic here in North Oklahoma City and is actively seeing patients. So we're very excited about collaborating with him and having the opportunity to really get into the deeper nature of maybe what's been even driving your predisposition towards an inflammatory state, looking at things like your gut biome, what's going on with your personal nutrition. And I will tell you that I am always so impressed with Dr. Santana and the level of detail that he gets into. And that is often a nice pairing with the things that we do to help patients live their best life. And so if that's something you're interested in, we can certainly introduce you to that side of things as well. So this goes way beyond even just your musculoskeletal health. We're very keen to help people perform and stay as active as they'd like to be, as long as they can. So that's our goal. So I appreciate you guys for tuning in this evening, and looking forward to meeting you personally and helping you with your musculoskeletal condition. And so reach out to us, give us a call, reach out to Amanda, and happy holidays for those of you out there that I don't get to see before Christmas, and enjoy all your holiday festivities. And thank you again so much. This is Dr. Keley John Booth, spine and joint specialist at Orthobiogen in Oklahoma City, signing off.